Hello, my name's Ian Buckle. I'm really looking forward to coming to Western-super-Mare to talk for the BACD on managing the worn dentition in a minimally invasive way. Very often when we talk about worn dentition and we talk about minimal invasive, we look at new materials that we think will be the solution, or we talk about new procedures, the new way that's going to solve all our problems. In my practice, my patients have multiple problems and not one size fits all. So the key for me is in be able to design the system to understand where the teeth need to fit in the patient's face so that we create beautiful aesthetics and also great function so that things are going to work really well for the patient. If we understand that, then the choice of the materials and the choice of the procedures comes between you and the patient, and we can choose something that's not only clinically appropriate but also financially appropriate for that patient. So we're going to be talking about different materials. We're going to be talking about composite and also porcelain and other indirect materials. We're going to talk about the normal analog methods and also digital methods, but we're also going to talk about ways of being able to place composite so that we get the predictable and beautiful results that we'd all like. So we're going to be talking about freehand methods, we're going to be talking about guided freehand, we're going to talk about semi-molded techniques, we're going to talk about fully molded techniques where we can take impressions of the diagnostic wax up and then we can use that to place multiple restorations at once and at the same time be very predictable and efficient. We're going to talk about using a system called every other tooth so that we can place multiple restorations and we don't get them all stuck together. We're going to look at these little trays as well that we can use for guiding us to make some really nice posterior restorations with nice morphology, and then we're also going to talk about a direct indirect technique where we can maybe make the restoration on the tooth to sculpt it on the tooth, but then to remove it so that we can heat temper it and we can treat it and polish it and then cement that in place, which can be a very, very nice way of doing this so that you're not working in the patient's mouth the whole time, and also the patient hasn't got their mouth open the whole time as well. So we've got lots of different ways. Now, having all those ways at our disposal means that we can usually find a solution that's going to be appropriate for our patients. We're going to talk about some concept as well about maybe why repairability is more important than longevity. Sometimes traditional full mouth rehabilitations, when the restorations fail, they can fail catastrophically, whereas if we can restore the patients in a minimally invasive way, then we get the chance to maybe keep them ticking over throughout a lifetime. But we also got to realize that we want to create beautiful results, and if we're going to do that, we have to work with the patient to try and understand what it is they're trying to achieve. So in this lecture we'll be looking to address all of these issues and hopefully some more things. Hopefully it'll be very informative. We always learn lots of different things from the people that's there. We'll be talking about it in a digital and analog manner, and of course hopefully we'll have a nice time together as well. So if you can, get yourself along there. It'll be a fun day and we'd be glad to see you. Thanks very much for listening.